3 blocks, triple bypass surgery at 17 years old with a device implanted in her. And she's in that interview. So your care for her as a patient, like you look at her in that interview, do you even realize that she has a heart device, that she had a cardiac arrest, that she had a triple bypass surgery the year before? So just to add to Davidson's extreme imagery on that side, I want to give you the extreme imagery on the other side. She looks absolutely healthy. She just had some shoulder pain. Well, you're an athlete. Well, you golf every day. Of course your shoulder hurts. You're getting old. You're aging. You're 55 and you're on the golf course every day. Of course you've got aches and pains, man. That girl was 17. So just, right, so whenever I'm thinking about any of these conditions, any of these clients, yes, I'm being tested in these rigid boxes, but when I'm thinking about what I'm doing to help a client, I see coronary artery disease or something on that chart. I know that they have it, but I might have a client who looks like her. And then this might be a client we're doing exercises maybe together because she's getting her strength back, maybe. I don't know. But just in terms of that, like giving another extreme visual. I love the extreme visual. So Davidson's one was really good. That post-op, elderly client, elderly caregiver, right? That's a really strong visual. But then also the opposite of that, this young, healthy person. So this coronary artery disease, right, this heart problems, they could affect us during our lifespan. Fair? Because I want to keep going. I'm making a note for you, Charles, okay?
Between snoring and what?
Get some more literature. Yeah. Well. Okay. La da 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 da. Oh, I don't want to go down that road, Myrna. So yeah, not necessarily directly, but not needed to talk about in Mosby's per se. Don't hate me. You can Google more info if you want more. But yeah, I'll go close that one for our class stuff. And probably Mosby says doesn't bring it up. Okay. I sent you a link privately. I've heard of young people having heart attacks. It's crazy stuff. Yeah, right. Because like I said, with her, she just had shoulder pain. Easy to say that's related to mobility, sports. You've got MSK stuff. Go to the physiotherapist. I bet you she went to see so many physiotherapists for her shoulder pain too, right? No, Myrna, I already put it there for you. It's already in your package. Don't worry. Okay. So if we have the process of the artery of our tube narrowing, or the walls. So the walls can either get thicker or we can have plaques or whatever, but the tube diameter is getting narrow, right? We're seeing this as atherosclerosis, okay? One artery could be affected or all arteries can be affected, right? So that's why person A is different than person B. Where is that thickening? Where is that narrowing happening? It's different in Linda than it is in Charmaine, right? And Siobhan, hers is even different too, and a different percent, even more. So again, right, that's it. I want to have this understanding, this knowledge, okay? People with hypertension, these are my heavy hitter things to be worried about. So I make sure I keep them on my checklist when I'm doing my care, when I'm doing a stuff, right? So like dizziness, chance of dizziness.
Kakagising ko lang.
Hypertension, right? There's heart stuff going on. I'm going to make sure that they don't get dizzy and fall when I stand them up. That's my job. I'm doing that a lot. I'm going to make sure you don't fall on my watch. I'm going to be asking you about dizziness, right? I'm watching for those signs and symptoms, right? Ultimately, muscle, heart muscle, is getting less blood, right? Like I said, it could be collection of stuff, or it could be the tissue thickening, whatever. We're not cardiologists, so we don't need to be that in depth at that level. But knowing that there are a variety, right? There's a variety of ways that it can. Mosby's touches a couple. But if it's blocked, if the artery completely gets blocked, then it can get through. So how does the tissue get oxygen and nutrients? It doesn't. And if it doesn't get what it needs, it's going to die. We can't recover that dead cardiac tissue, right? So we don't want to have permanent blockages. We want to fix them. We want to keep them open. We want to keep them as the flow as good as possible. We want good flow. So that's why Davidson had mentioned we might do that balloon thing. There's lots of different weird things that we can do to help people, right? We're not surgeons, so it's not that big of a deal for us to know all of them. But if we go in there, we put the balloon in, and we inflate the balloon, it's to smush all that stuff, smush it to make the tube bigger again. That's the point. That's what we're doing with that. Okay? We're trying to make that flow better. Okay? Cover those risk factors well. Yeah. So angina is chest pain from reduced blood flow to heart muscle, specifically. Angina pectoris is the term. I didn't assign angina, did I? No. I don't think so. And so angina pectoris is the term for that chest pain that you feel, but the cause of that chest pain is related to heart tissue not getting the oxygen. So if you have a broken rib and you have chest pain because you have a broken rib, it's not angina pectoris. You see that, what I'm saying? Angina pectoris is because of reduced blood flow to that heart tissue, which is coming out as pain, okay? So it's related to heart, right? It needs more oxygen. The heart needs more oxygen. So why isn't it getting enough oxygen? Because we're having reduced flow in there somehow, right? By the narrowing and that kind of stuff. Now I'm gonna finish angina pectoris and we'll segue into brain next. It might feel like pain. It might feel like heaviness. Some people will describe it as they'll say like it feels like someone is sitting on me, like just feels heavy, like there's textbooks. Mostly this heavy textbook laying with a textbook. Just feels heavy. It's really hard to describe feelings sometimes, right? So you know me related to something. To hell if it's someone is sitting on my chest. Okay? It might be they might say it's tight. It feels really tight. Variety. Right? A variety. They may be pale. What do I know? There's blood restriction happening here. So something's going on with that circulation system, right? So they might be pale. They might be feeling faint. Okay, makes sense, right? I don't know. Diaphoresis. They might be diaphoretic, sweaty. I don't know how often the textbook uses the proper word. So if you see it, I use that instead of sweaty. I don't know what does Mosby say? Sweat? Does it say diaphoretic? I don't know. But that's it. If you hear me say diaphoretic, you hear the doctor say diaphoretic, you say, he's really diaphoretic. You hear that? It means he's covered in sweat. Okay? You'd be on my head. No, David said you're supposed to sleep on it so that the knowledge absorbs through your ear. It's just what's the term for that? Where it just goes in, absorption through your ear canal, the knowledge into your brain. But that diaphoretic, if you hear that diaphoresis, they're meaning that sweatiness. Okay? The sweatiness. They're getting sweaty. Okay? Dyspnea, we know that word now. That shortness of breath. Dyspnea. The client, you might see it in the chart written. I'm sure that Mosby's doesn't. Oh, of course I can spell. To go with my last one, it's not, you don't have to write them. just as the extra, you're reading a chart and you see that the client was dyspneic. They're suffering with dyspnea, shortness of breath. Watch their breathing rate, watching their respiratory stuff. But diaphoretic, the sweaty part, dyspneic, where they have dyspnea, that's the shortness of breath part, okay? With angina, rest often, not always, no primary marker, but rest will often help to relieve symptoms. So somebody starts to get that chest pain, you want them to stop, sit, have that calming, like try to calm that body, reduce stress, because it's reducing the oxygen need of the heart muscle, right? I work harder, I need more oxygen. So if I'm having that pain, that's why we might see them feel better with a little rest period, okay? Angina is the one that they're gonna walk around with that nitro. That you see they've got a little red thing, they spray some stuff under their tongue. It's a drug, nitroglycerin. Some people wear it as a patch, literally. Oh! MI's next. So I'm going to finish angina, then we're going to do a break, and then you guys can do MI. Thanks for telling me. Oh, I'm so sorry. Heart issues absolutely can be lethal. Yep. Which is, that's PTSD, right? Avoiding research, avoiding learning more because, right, it's actually, right, it really actually relates. I lived experience with this type of topic, and probably also, if it's okay to bring you up, Danielle, but also difficult for you to have your own experience. Like now knowing 3 weeks ago, you mentioned your chest pain that you referred to cardiology and all that kind of stuff. This comment now makes that comment even more real. And I think about her mental health experience with her health journey right now. See how we look at our clients? So I don't mean to put you on the spot, Danielle, with this example. Okay. That's why we need to consider our clients holistically. Because we don't know what she wrote in that message to us. We don't know her history with heart disease and what her emotional experience is with it, right? So how do I help my client? Maybe this client needs that support, that encouragement, and piece of that too, right? That was in no way a play to bring sympathy to Danielle. It was totally me trying to use Danielle's situation to my advantage in teaching this class to push that empathy and holistic rounding, like thinking about our client as a whole person, and that there's other stuff that's affecting their experience right now. There's other stuff going on. I really appreciate you. Well, I really put you on the spot and kind of started without your permission, but I banked on my knowledge of you so far this semester, and that it would be okay. And that you shared the comment, I thought was also a little bit of an invitation for the discussion. So feel free to let us know how your appointments go if you need to. We're all here, right? We're all here. Whatever you need. We love you. But yeah, right, it's just a stark reminder. Right? It's slapped in the face. Sorry for assigning you MI. Have some exposure therapy, Danielle. Enjoy.
As soon as I got it, I was of course I would. That's the one I would.
You know,
As the first thing I'm like, please don't say my name, please don't say my name, and then my name.
even go, it depends on how spiritual people are. Well, maybe that was the universe deciding, you know what, Danielle, it's time for you to stop avoiding researching this topic. It's time to step in and research the topic. And you're here with us to give you the help, at least. Not alone. So yeah, we super love you. I'm so sorry to hear about your mom's situation at the end. That's really tough. That's hard to eat. That's hard to digest. Absolutely. Also, the video that I just played of that 16-year-old must have been pretty intense as well. And beautiful that they have AEDs and actually practice CPR training, right? That's really like that reason, right? If you could just start doing compressions, you literally could save somebody's life. So those kind of safety measures, right? Knowing that it could be a thing. But like, she didn't even know she had heart disease. Triple bypass at 17. Like, mind-boggling. Right? So you just don't know. You just don't know, right? My brother had brain tumor, cancerous brain tumor, right? Like, you don't know. Stuff happens too, right? Stuff happens. So at least we can, think about that client as a whole person. Think of them as a whole person. There's shit going on. That's it. I talked to you a little bit. I said the word nitroglycerin. We're good. Let's take a break. Come back. Then we've got MI. My note list is MI, and then CHF. Then arrhythmias. And then we'll be done this topic. So we'll have 15 minutes to get through. 5 minutes each for those topics when we get back. 10:25, so what is that, 10:40? For break?
What is
Is
CHF?
for MI.
Allie, can I ask you a quick question? It's Tracy.
Yes.
The last theory exam test, was that the final mark, the one initial mark that came back to us?
Yeah.
Okay.
Okay.
Okay,
You want to go over it?
okay, thank you.
We're in the error question answer part from the break phase. So, and everybody passed.
Right, thankfully.
I wasn't going diving, like trying to find any minute thing that I could find or anything like that, but it all ended up how it should have ended up. So next week I can meet with you if you want. I have like multiple meetings today, so
No rush, no worries.
Yeah.
Driving something silly.
yeah, the considering other ones that we've looked at, probably I'll do that.
It's okay.
But yeah,
Okay,
no,
thanks.
next week for sure.
All right, okay, let's have a break now. Yeah. Me too.
Yes.
I don't mind mentioning that
Pardon?
I don't mind watching TV. I would love to watch TV.
Oh, okay, let me find it. I'll put the link in the chat.
Okay, great.
Yeah. Oh, because you have to show other people probably too. And like, yeah. I'll put it in the chat box. Let me just find it again. I closed my YouTube. Okay, yeah, for sure.
Coronary heart failure. Is it? Congestive. Kumusta ang buhay dyan, baklos? Kumusta ang babaeng may magandang kamay dyan? Kailangan ng putulan ng buhok. Oh. Masyado ng... Okay, kaya kung mababa ang buhok. Jay, pwede na paiksian ang buhok ko, no? Taas na siya, oh. Taas na nasa likod.
Me too. Back. Keep putting the stupid drink to my left. Natural hand. But I face my computer is on an angle, so the left of me is directly in my elbow zone. So I keep elbowing my actual drink. At the request of Davidson, I hadn't thought of it earlier, but he mentioned that he would love to have access to that YouTube video. So I just shared the link. If it's something you are interested in looking at again or sharing with someone, or someone says, I don't know why we should have an AED here. You can show them that there's absolutely a reason to be trained in CPR and how to use an AED. But yeah, there you go. I know the quality's not that great, but it makes a point anyway. So sorry to bring it back to that video, but what I found was like so. She said 2 weeks before, she was in Honduras backpacking, like on and on. And like, what if it happened the 2 weeks before? That's exactly what she said, right? Like literally, had she gone back 2 weeks before, it would be a super different story. Like she's so lucky that it happened in the gym with people who had training and an AED there. And it still took them 11 minutes, the ambulance to arrive. 11 minutes to get there. So I was saying, like, here where I live, if you're at your cottage, if you're at, we call them camps up here, but if you're at your camp, like, the ambulance might be 40 minutes from you. That's far. Like, we send a helicopter ambulance to people here because we're at that distance. So you can relate that to anywhere you've been, anywhere you've traveled, anywhere you've lived. There's a big difference between being rural and in the city. So if you have people trained and you have like an AED, especially for us, if that's available, you can actually maybe help to save someone's life. There's this possibility. But yeah, so that's there. If you want that video, I just shared it in the comment thread there for you. What that ultimately sparked was buy-in from the school boards and the children's hospital, and they got government funding to buy more AEDs to put in high schools, those kind of things. So that's why they want to share those stories, as scary as they are, because it helps to get money to put them somewhere to help keep more people safe. So that's why they put it out there like that. You'll find that healthcare, people who are involved in healthcare and sports, athletics here in Ontario and Canada are huge advocates for sports teams to have an AED to travel with them, like the traveling sports teams, hockey teams and things, like for that very reason, right? You're on the road and something happens, and there you go. The rain is coming. Sorry if you can hear my chimes outside, they're getting louder as the wind picks up. Volleyball's what kept you in high school, yeah. Sports kept us, lots of us. Sports or clubs or like something kept us there. Okay, so I said we will come back. We will do MI. I gotta hit MI and CHF. I want 15 minutes left in cardio. That's my goal because I want to do endocrine quick and then we'll be into our lunch break if I can early, of course. Okay. So Team MI, whenever you're ready, if you would like to, we would love to hear what you have to say.
That's us, right, T? Yeah.
As long as someone knows. I don't. I sure don't know what's happening.
Okay, coming with you. 2 secs.
Today. Can you hear me okay?
Yep.
Okay, thank you. Myocardial infarction. Myocardium is the heart tissue. Infarction means death. Myocardial infarction causes death of the heart tissue due to lack of oxygen caused by an interruption of the blood flow to the heart because of either a thrombus, which is a blood clot that forms in the blood vessel, or the atherosclerosis, which is ultimately a buildup of plaque, cholesterol on the arteries, soft waxy substance. And it causes them to narrow, resulting in the slowing or stopping of the flow of the blood to the heart, which carries the oxygen and nutrients. If the plaque bursts, this leads to a blood clot or thrombus obstructing the artery and can cause instant death, called cardiac arrest. Myocardial infarction is also known as MI,
Maraming
Heart attack,
salamat, bossing,
coronary,
birthday.
coronary thrombosis, and coronary occlusion. In Canada, there's an estimate of
Salamat,
1.6 million
salamat.
people living with heart disease and its effects. And now we have Danielle.
Okay, so summarize, myocardial infarction is caused by lack of oxygen to one or more areas of the heart muscle, caused by a loss of blood flow to the heart muscle. Coronary arteries are blood vessels that supply oxygen-rich blood to the heart to keep it pumping. Without this flow to the heart, it becomes oxygen-starved and kills the heart tissues to cause myocardial infarction. Although a heart attack can happen with no warning signs, there are warning signs to look out for.
Salamat,
Such as
sir,
shortness of breath,
bossing.
pain, pressure, tightness, squeezing in the chest that may spread to the arm, the neck, the jaw, cold sweats, nausea, indigestion, heartburn, fatigue, lightheaded, and some dizziness. When someone is suspected to have myocardial infarction, they are given aspirin to swallow, as this has a rapid effect and reduces mortality to 20%. And an electrocardiogram can confirm myocardial infarction. There is some lifestyle changes you can use as a preventative measure, such as not smoking, eating a healthy diet, lowering high blood pressure, be physically active on a daily basis, reduce stress, manage diabetes, aim for a healthy body weight, reduce saturated fats, trans fats, and cholesterol, and limiting alcohol intake. And back to you, Tracy.
Thanks, Dee. PSW
Where is my
must report symptoms to their supervisor immediately when anything is wrong, as many clients disregard the early warning signs of MI. Especially older women are known to have MI for at least 1 month before acknowledging the signs and seeking medical attention. On average, it takes the average person about 5 hours before they seek medical attention once they have the signs of MI. Rehabilitation is based on the goal of preventing another heart attack. The following types of treatments are provided to a client following myocardial infarction. First, defibrillation. Only if it's given within the first few minutes will it improve the survival rates by up to 50%. Providing oxygen, administering medicines for pain, and stabilizing the client's vital signs. Being mindful and help the client to remain calm. The client will have modifications to their activities of daily living, such as their exercise programs, changes in their diet. Rehab will be slow, but it's necessary in order for the client to hopefully return to their normal levels of lifestyle. The role of the PSW is very important during the client's rehabilitation, as they assist the client daily. They're on site for the emergencies, and they are responsible to observe, report, and record in the care plan at the end of each shift. This provides the family and the medical team updated information daily to make any necessary ongoing client care assessments.
That's all we got today.
That's awesome. Any questions for our group? You summarized really well the Mosbys. You got everything in there. Good. Could be small or large damage, like you guys were mentioning. We definitely want to send to emergency room if we're able to, if right, they're having those symptoms, for sure.
Oh yeah, sorry, CCU.
You gotta send them for help somehow. We'll figure it out.
And for every minute of delay of not having the defibrillator, you're losing 7 to 10% of your life of survival, chance of survival. Every 1 minute.
Why we always want to start compressions, even if we don't know what caused that person to go down. We start compressions right away. There's no AED, doesn't matter. We start compressions, call 911. If we're out in community,
Pump it up.
Enjoying some sun, and then all of a sudden, so people are screaming, "What happened?" Start CPR, call 911. Start those compressions. Call, and like you saw in that video, like lots of places, the cities, they put AEDs around, so like lots of parks and arenas, schools, they actually are having AEDs in them now, actually, for real. So you start screaming bloody murder, call 911, get an AED. Where is it? Somebody might know there's an AED right, like in this building right here. Like, let's grab it. So you have to be really vocal when you guys do your CPR training there. You get recerted and all that kind of stuff. That's why we practice. That's why we want everyone to act really silly while they're practicing, so that in real life you actually are yelling out for help, right? Master, and yeah.
For CPR, you have a certificate, right? You get the certificate, and every year you have to update it.
You redo it, yeah.
And what if it happens in the scene? You are in the scene, and you had this certified, but it's not updated. Can you still do that?
Yeah, we have laws in place here to protect. They're to protect the bystanders, to protect you from helping. So the family cannot sue you from doing CPR. We have laws to protect the person helping. So just because if my CPR is expired and someone is on the floor, I'm still doing CPR. Yeah, absolutely. There's not a chance I'm not going to. That's just where I'm at, right? But yeah, likely there's more than one person around. More often, at least in Sudbury, which is likely in the GTA as well. But here, because we have like a major hospital, when I pull over to the side of the road because there's an accident or something like that, I actually typically I roll up and we're like, you need help? And like all the time, there's like, we got 2 off-duty nurses, there's 1 off-duty paramedic, and I'll be like, hey, you need extra hand? Like, no? Okay, we'll go. Like, they've got it, and they have and EMS is coming, right? The police are coming on scene. They have all these off-duty groups. So everybody, there's lots of people around who know CPR. There are. It's always just verbalized. Hey, I know CPR. Do you need help? If nobody knows, you take over. You say, hey, I know CPR. You need help? And they're like, we got 10 people already. Don't be a burden. Do you need help? I can do something else. But that is a little side extra. There's more people than you think are certified. So call out for help, but don't hesitate. Start. Like I said, you don't have to do breaths right away. Don't even do it. If you don't know the person, you don't have to. Just start the compressions of the areas. Get that thing circulating, get it going through the brain so we don't have brain tissue issues, we don't have heart tissue issues, right? We just keep it moving. Eventually, someone will come with something so you can start giving airway. But in the worst case scenario, this is not a CPR lesson, but like, just do compressions if you got nothing else, right? I'll add this too before you guys start your bit here on CHF. I get asked this question when I teach CPR and from all of my learners, without doubt. They always ask me, say, Ali, like, what if I break their ribs? What if I don't, like, I don't mean this to be crass, but your option is dead or broken ribs. Like it's actually that basic. That's the ultimate. Like, if I don't do the compressions, we're waiting 8, 11 minutes, 20 minutes, half an hour. That's exactly it. Victoria nails it. Do you want to be alive with 6 broken ribs, and a little bit of rehab and then fixing your heart stuff, or not, right? If you don't break ribs, you're not doing it. Well, they said that to encourage it because it's better to, most people don't want to press hard enough. So when we talk in those major extreme examples, we're going to tell you it's better that you're not doing it right if you don't break ribs, because most people are so scared that they're going to break ribs. They're not thinking about saving the life. They're actually thinking about ribs breaking. So we say, try to break the ribs. But you can do effective CPR without breaking all the ribs, but we would prefer you try because it's more likely, right? The evidence suggests that you're not going to press hard enough. It's the don't be afraid. We're just trying to connect an extreme example so that you get in there, right, and do it. But yeah. At the very least, get on, do compressions, good compressions. I've done a lot of CPR, and I can tell you, Tracy, I've broken lots of ribs doing it. Yeah, absolutely, without a doubt, it's happening, absolutely. But it's not. This is for my level. It's not what I'm trying to do. I'm trying to get a particular depth. That's what I'm worried about. If stuff snaps, it snaps. If it doesn't, it doesn't. Like that's not my. I'm not worried about that piece. I'm worried about my depth. That's it. But yeah, I would definitely, right? If you're only getting a little training on it, very infrequently, I'm going to tell you, go for broke. I want you to press into the floor, because it's more like you're not going to circulate that pressure, and it's more likely that we're going to be able to maintain some pressure if you're pushing really hard. So just for that bit. CHF, please enlighten us.
Okay, that's me and Linda. So I'll start it off. So heart failure, also known as congestive heart failure, CHF, it's a chronic condition that doesn't mean the heart has stopped. It just means the heart isn't working at its full pumping power. It occurs when the heart has trouble pumping blood through the body. When I was reading Mosby's, there was like a little blurb. It wasn't too much information, so I did go onto Google, and I did the Mayo Clinic and the Heart Foundation. But so from Mosby's, it did say that CHF can affect the right side and the left side of the heart. So for the right side, it says that when the heart fails, the blood would back up into the veins, which builds up a collection of fluid. And then for the left side, when the heart fails, the blood will start collecting into the lung tissue, which results in difficulty with breathing. Also, the major causes of CHF include coronary artery disease, which Siobhan and Davidson touched earlier, a heart attack, or high blood pressure. And as we learned earlier, like muscles in the elderly, they weaken, so that is also, it's most common with the elderly. And then Linda will touch on the signs and symptoms.
Yes. So some of the symptoms would be for heart failure can be ongoing or chronic, or it may start suddenly. Heart failure signs and symptoms may include shortness of breath with activity or when lying down, fatigue and weakness, swelling in the legs, ankles, and feet. Can be rapid or irregular heartbeat, reduced ability to exercise. There's quite a few here. Persistent cough or wheezing with white or pink blood-tinged mucus. Swelling of the belly area, abdomen. Very rapid weight gain from fluid buildup. Nausea and lack of appetite. Difficulty concentrating or decreased alertness. And the last symptom or sign would be chest pain if heart failure is caused by a heart attack. So I was going to Mosby's book here on 866, and the care plan would include, for the PSW, would, of course, we're going by the care plan for that particular client. But some of the things that Mosby's listed is maintaining bed rest, measuring intake and output, measuring daily weight, ideally before eating and after voiding. Let's see here. Restricting fluids as ordered by the physician, assisting in transfers or ambulation. Also assisting with self-care activities, which would the PSW would assist. Maintaining good positioning and body alignment according to the care plan. Applying, also, actually, the last thing would be applying elastic stockings to reduce leg swelling. And actually, my daughter had to wear those for a while after giving birth to her fourth baby. And that is that.
And then for the treatment options, they would put you on different medications that can help strengthen the heart or reduce the amount of fluid in your body, such as I think it's a diuretic. They might put you on a sodium restricted diet. It, I guess, depends on the stage you're in. You might have to do surgery, or they might give you, gosh, the word is, they might it's like something that they would put, I forget what the word is. I had it earlier. And then they might be doing maybe a cardiac rehab to help maintain a heart healthy lifestyle. Yeah, that's about it.
That was awesome. Nailed it. Nailed it. A couple points that I wanted to make to add on, tack on here, were, let's see, my trick for CHF. When they explained there's right and left, I'm going to use my really extreme examples here, but my either the backup is in the body, as I mentioned, or the backup is in the lungs. Okay? Left-sided L for lungs. Left-sided heart failure backs up into the lungs. LL. That's, so I don't know what right-sided does. I only remember my L. Remember how I always memorize one, so the opposite has to be true. So my left side lungs, LLL, left-sided heart failure backs up into the lungs. If it's backed up in the body, I'm a balloon of edema. Okay? We've got big ankles, big calves, big knees, big sausage fingers. The fluid is backed up in the body. You see the swelling, the body's swollen. When it's left-sided and it's in the heart, in the lungs, you got two lung bags in there, right? They're full of fluid and all that tissue. That person doesn't necessarily have swollen feet. They don't necessarily have the swollen fingers because the fluid's in those lungs. It's not in the body, the backup, okay? So if the person's looking at you and say, oh, I'm an advanced CHF, I have a friend who's in end-stage cardiac disease. His ejection fraction is so low. He literally can't have a conversation. One sentence turns him blue. That's how hard his heart is pumping to help him even speak. Okay? But he's not swollen. There's no swelling. He's not edematous at all. But he cannot breathe. So, okay, so just to write my extreme examples there, left lungs, imagine we're filling up the lungs. Okay? So if I'm imagining that my lungs are full, here's my segue into that PSW thoughts. And when Linda was explaining, assisting with transfers and ambulation, maybe the body position, they don't want to lay flat. You got to put them with the head of the bed up. Remember, if my lungs are full of fluid, can I breathe through all that fluids? The swelling and stuff in there, right? So it's hard to breathe. So that's why you're seeing that dyspnea, right? The shortness of breath.
Hi,
so if I'm full
how
of fluid and I can't have that transfer, right? That gas exchange isn't happening well. What is that going to look like when I try to walk to the toilet?
I know, meron pa akong
Right?
Did you hear my
Because I can't move that air that I need to move.
Meron pa akong report
Okay.
sa
Right? The pneumonia. If I'm full of
diabetes.
pus and fluids in there, I can't like that because it's a surface area thing, right? Surface area, the gas exchange. Fair?
Tapos na klase rin yun?
If
That's
gas
so
exchange
nice.
is happening across this whole cup, and I fill the bottom with fluid, I still have lots of area to do gas exchange, right? If I lay flat, more area is covered by the fluid, so there's less area for gas exchange. Make sense? Can you follow that point? Or was that you're more confused now?
Our teacher started explaining what.
I just was thinking about if this fluid go back to the lungs, and the lungs get the the small sac.
The alveoli?
Alveola. They are getting the void and if it drain the liquid somehow, after they would end up with the emphysema, because after they have problem with the chest getting bigger.
So, you went straight to your
It's
work.
not like we're pouring, like the tissues are becoming
Went straight to your work.
engorged with it. So it's not the same
Sa
mechanism
bahay
that's
niya.
happening.
Did you talk to her?
So often when I look at my left-sided CHF
Sana daw
clients,
may
they don't look
nakatawag.
like, they just look like a normal person who's short of breath.
Sana daw may
Right.
tumatawag sa akin.
Not
Sabi ni
not
Joy.
very.
May Joy din ako dito eh.
But the right
Isang
sided,
nakaano
they
ako.
are swollen like a balloon because the fluid is backing up in the body tissues instead of in the lung tissues. So they were mentioning
Ano,
and you have like more
tayo.
sputum, more mucus production. They're coughing,
Mamayang gabi may
gurgly
klase ako,
sounds. You're
mamayang
going to
gabi.
hear like it sounds like it's wet in there, and
May
it's not
Zoom
happy.
meeting
The
ako
lungs are
mamayang
not
gabi,
happy.
diba?
In there. That tissue's not happy. Okay. They mentioned good treatments,
May Zoom
right? The
meeting.
elastic stockings.
7
Use for a
o'clock ang Zoom
variety of
meeting, right?
purposes.
And
I
then
tell
tomorrow
every
morning may
single
Zoom meeting
student that I
ulit
have,
ako.
you need to own one pair for every shift. If you walk, remember I said
Are
good
you going
shoes?
to connect me to the
You have
Wi-Fi
to-
there?
I'm telling you. Because at 25, I was working a 12-hour shift
Finally,
and
my-
coming home, and I was swollen to my
Sabi
knees,
ni
both
Paul.
legs, 12 hours straight. Going. Put those on, I can walk forever. So they go right in hand with the good shoes that I told you to buy. You see runners wear them. Professional athletes wear compression socks. Basketball players wear them on their arms.
Sige, invite mo
To
si
provide
Marian.
more stability, to help blood flow. Ultimately, if you work a
Anong
12-hour
oras?
shift standing, it's right. It's got a pool in our feet, so we as healthcare workers, we wear those socks, those nice tight socks, to help reduce that swelling. If you come home at the end of the day and you got big swollen ankles, go buy some TED stockings. Buy some of those athletic anti-thrombolytic
Paano
socks.
tayo
That's bad,
ano
that
niyan
you
kapag
get.
alas 5 na sa is nandito pa?
Athletic socks.
Paano tayo
So well done, elastic stockings. That's what I mean. Anti-thrombolytic stockings, whatever. But yeah, that's why we might need help with those transfers and bathing, because I'm gonna get so out of breath and I'm gonna tire, become so fatigued so quickly. And if oxygen consumption, if there's not the gas exchange, I can be dizzy. Right? There's other things that can go along. So if I'm pushing myself to have that
I'm
bath,
listening to my
That's
teacher. Did you
risky.
hear my teacher?
if I'm going to pass out in the bathtub because I'm trying too hard to bathe. So does that
Ano
rate
mo siya
that
maintindihan?
thinking about our client?
Kausap kita.
An arrhythmia is an abnormal heart rhythm. We don't go into huge detail there. That little girl
Daanan mo ako
in
dito.
the video, she ended up with an arrhythmia. She had an
Good night,
abnormal heart
Joy.
rhythm. Okay, but subsequently, once they investigated, she ended up needing triple bypass.
Love
She
you too.
had such issues, right, with her heart. Usually, an arrhythmia is not life-threatening. Some people, they get a little medication, it's okay. But it can be serious. It cannot be right that spectrum. Love it. It may or may not be.
Sige, daanan mo ako mamaya.
If it's really bad, like that little girl, they're gonna put a machine in there to help
Hindi
the
na kayo
heartbeat
uwi.
regularly, to zap the heart rate. It's like a little mini AED. It's like walking around with an AED
Oh, okay.
implanted
Sige,
in your
I will
heart.
get myself
Dip,
ready.
dip, dip. Beat
And
properly,
then
my
you
friend.
invite Maria
Okay,
later.
pacemaker.
Ano ha, I
What's
will
the
not
pace? The
contact her.
pace of the runners. You may have heard that with running pace. Or
Okay,
if you
see
watch
you,
car
bye-bye.
racing, the pace car. Right, you're setting a pace. You're setting a rhythm. So we put a pacemaker. We put a rhythm maker in your heart, and it helps to keep you on a regular rhythm. Okay. Is that like crayon answer? Is kind of okay? Makes kind of sense. But we can actually surgically put that in there to try to help if the arrhythmia, the abnormal rhythm, is dangerous. Okay. Maybe it's okay, we take the medicine and it fixes it. Okay, cool. Then there's the medicine fixes it. Cool. But we can go all the way to surgical intervention if required. Okay. If your client has a pacemaker or something, you just put your shock pad beside it. Like, just don't put it on top of the, you know what I mean? So if there's a thing sticking out of the chest, you just put it beside. Okay? When you put the sticker on, you just put it beside. I come upon someone on the field, and I say, oh, I know what to do. And I look, I say, oh no, there's something in it. I just put it beside. It's okay. Just put it beside. This is my talk for everybody. You're okay. You can still do it. Keep going. Start compressions. Okay, so phlebitis, inflammation of the vein. I got phlebitis. Problem somewhere. Okay. Often occurs in the leg. Okay. Can be caused by bacterial infection, among other things. Okay. You have redness, warmth, pain, swelling. Oh shoot, all signs of infection. We've learned about list signs and symptoms of infections, right? So that area, that part of the vein is having an itis. I'm gonna call that that's a thing now. It's having itis. Okay, so thrombus. A thrombus is a blood clot. Clots. Okay? If you get a big clot in a big vessel, in a big hose, okay, it's going to reduce that diameter, right? There's a big clot in there. So it's going to reduce that flow. It's going to reduce the flow through that tube, right? So we're having abnormal stuff going on there, right? If it's in a small tube, the blood clot could completely close the tube, right? So in a big tube, it could reduce. In a smaller tube, it's likely going to obstruct completely, right? So no flow, okay? Can stop, not always. It's not permanent marker, but can stop it completely, right? Plug, it's a plug. Like in the drain, in the bathtub. Put that in there, no more. It's not going to go through the tube anymore, right? Clots can form for a variety of reasons, of course. Could be problems with your blood factors, could be after other, or related to other coronary diseases, heart stuff, right, that we've been talking about. Lots of interrelated concepts here, right? And disease, little things, they're all working together. It could be for a variety of reasons. Sometimes we can even see blood clots form because of inactivity. Super prolonged bed rests with some stuff going on, right? Comorbidities and things like that, we might see a blood clot form. Okay? If it moves, it's called an embolus. Okay, so the blood clot moves. And does Mosby's talk about DVTs, deep vein thrombosis? I don't think it came up as an actual topic. No. Okay. So we do these cool things. This is outside of Mosby's. We do this cool thing. If there's a clot lower in, we have these, like a colander. What is it? Like with all the holes, so I put the vegetables in and I wash so the water goes through, but the vegetables stay. We have these cool devices that will put it in your vein, or in the vein. It's like a little mini colander, so that if the clot breaks, it gets caught in the colander so that it can't come up and give you a heart attack or something. Can't move too far. We're going to try to catch it. If that's not an everything. That's not an everybody thing. I just want to, hey, there's a cool thing that we can do with some people. It's a cool surgical intervention. We stick this mini colander in their leg veins, the big one, to try to catch the bad clot, so it doesn't go up to our hearts and brains and stuff like that. It's just a neat little extra for you all, okay? It's cool. Science is cool. Surgery's cool. Interventions are cool. But unless we have good evidence and documentation, we're not going to be able to get them into the physician to get those interventions made. So we need to still do good documentation and evidence collection, right? No, Tracy, who would qualify? Like based on the clot, where it is, your risk factors. Like, I don't know, I'm not the doctor, I'm not the surgical team. They decide if you're qualified for surgery, not us. I'm just saying it's possible. If you tick those boxes, there's some cool stuff that they're going to do with us, right? Even Davidson's example, the balloon, right? For the plaques, where they opened the balloon inside the tube to smush and make the plaques shrink a little bit. Well, they didn't shrink the plaques, they just spread it longer, right? So instead of a pile of peanut butter, they spread it thin. That's what the balloon did. So I'm just saying, cool, there's cool stuff, interesting solutions, interesting interventions, depending on the exact story of each person. We're so unique. Right, so just a little cool thing with that. The colander thing is really neat to me. It's super cool. Like catch a clot catch the embolus. Right? It's neat stuff. That's it. 11:17. So that's the stuff I wanted to cover from that. Can I get 30 minutes for endocrine? 30 minutes. Any burning questions about that junk that we just learned? Heart junk.
To understand diabetes, first we must understand how glucose is normally processed in the body.
Be nice and short.
Insulin is a hormone that comes from a gland situated behind and between the stomach.
No.
It's called pancreas.
No, Davidson, because who in their right mind stands at an emergency scene and says, I don't like their face, so I'm not going to hurt them? What is
Ouch! Shut. See? I dropped everything. Oh, it's broken now. Uh-oh. Oh. Sorry.
hope the police come and charge you with hate crimes. End of story. So I don't. There's not a law that says like, oh, you drunk. I don't. No, we don't run around charging. We don't even like put people who drunk drive in jail. So like, nothing's gonna happen. But you are absolutely protected as a bystander for doing CPR on someone. You're not going to get sued because you broke their rib. You're not going to get sued because they didn't live after, like, they died at the hospital. They can't. You're protected from it. You were helping and have this set in our legislation. No. You're supposed to help. Okay, you're supposed to help. As a registered staff, you're fine. Don't worry about it. Help if you can. Help. At the very least, call 911. You're helping. You're not walking away from it. You can choose not to touch anybody. Call 911, right? But, yeah. There's no criminal charges in Canada for anything. Let's be real here. Okay, so endocrine. I gotta jump. We got endocrine system. It's all our glands, junk like that, right? Yes, now strand, some breathing stuff only allows our air to go in. Other stuff goes a different direction. So it's one-way valve airways that we put into first aid kits. Yeah. Okay. So basically, the endocrine system makes hormones and stuff like that. Okay, like the crayon version. Making hormones. It affects other glands, other hormone makers, all kinds of junk, right? So our most common endocrine disorder is diabetes here. And I know I assigned diabetes to somebody.
That's me.
Sure. Good. Welcome, Team Diabetes.
Can you guys hear me?
Yeah.
Because I'm outside. Okay, what is diabetes? So diabetes is I'm not sure I'm pronouncing this word right. Mellitus refer to a group of disease that affect how our body use blood sugar, such as glucose, Glucose is vital to our health because it's an important source of energy for the cells that make up your muscles and tissue. It's also your brain main source of fuel. So there's two types of diabetes, and type 1 and type 2. Sorry. So type 1 diabetes is the exact cause of diabetes 1 is unknown. What's unknown is that your immune system, which is normally fight harmful bacteria or virus, attack and destroy your insulin producing cell in the pancreas. This leaves you to a little or no insulin. Instead of being transported into your cells, sugar built up in your bloodstream. And type 2 diabetes is your cell become more resistant to the action of the insulin, and your pancreas is unable to make enough insulin to overcome the resistance. Instead of moving into your blood cells where it's needed for energy, sugar builds up in your bloodstream instead. And some of the signs for diabetes are frequent urination, extreme hunger, unexplained weight loss, fatigue, blurred vision, and slow eating source. And frequent infections such as gum or skin infection and vaginal infections. Belen?
Okay, good morning, everyone. This is just to summarize my partners in crime here. To understand diabetes, first we must understand how glucose is normally processed in our body. How insulin works. Insulin is a hormone that comes from a gland situated behind and below the stomach, which is the pancreas, that secretes insulin in the bloodstreams. Insulin circulates, enabling sugar to enter your cells. Insulin lowers the amount of sugar in your bloodstreams. As your blood sugar level drops, so does the secretion of insulin in your pancreas. What is the role of the glucose or the sugar? Or the sugar is the source of energy for the cells that makes up the muscles and other tissues. Sugar absorbs into the bloodstreams where it enters the cells with the help of the insulin. Your liver stores and make glucose. When your glucose level are low, such as when you haven't eaten in a while, the liver breaks down stores glycogen into glucose to keep your glucose level within a normal range. Okay, we have type 1 diabetes and type 2 diabetes. I will not take up that one because she did it already. We have hypoglycemia. Hypoglycemia is a condition where a person's blood glucose level is much lower than normal. Occasionally, hypoglycemia is treated by giving a high sugar food or drink to help return the blood sugar levels to a healthy range. Chronic hypoglycemia, on the other hand, requires investigation to identify its cause, followed by appropriate treatments. The signs and symptoms of hypoglycemia is an irregular or fast heartbeats, fatigue, pale skin, shakiness, anxiety, sweating, hunger, irritability, tingling or numbness of the lips, tongues, or cheeks. Sorry. Next is the hyperglycemia. This hyperglycemia is a high blood sugar affects people who have diabetes. Several factors can contribute to hyperglycemia in people with diabetes, including food and physical activity choices, illness, non-diabetes medications, or skipping or not taking enough glucose lowering medication. And all right, the causes are there already. And then, okay, I think she didn't mention the gestational diabetes. We have also this gestational diabetes. This will happen during pregnancy. The placenta produces hormones to sustain your pregnancy. These hormones make your cells more resistant to insulin. Normally, your pancreas responds by producing producing enough extra insulin to overcome this resistance. But sometimes your pancreas can't keep it. When this happens, too little glucose gets into your cells and too much stay in your blood, resulting a gestational diabetes. What are the risk factor? Risk factor of diabetes depends on the type of diabetes. Um, Although the exact cause of type 1 diabetes is unknown, factors that may signal an increased risk include the family history, environmental factors, the presence of damaging immune system cells, yeah. Sometimes family members of family with type 1 diabetes are tested for the presence of diabetes antibodies. If you have these autoantibodies, you have an increased risk of developing type 1 diabetes. But not everyone who has this autoantibodies develops diabetes. What else? The risk factor of type 2 diabetes, we have the weight or inactivity, family history, your risk increase if your parents or sibling has type 2 diabetes. Also, risk factor is the race or ethnicity. Although it's unclear why certain people, including Black, Hispanic, American, Indian, and Asian American people, are also at risk of or higher risk of diabetes. Also, the age, the gestational stage, the gestational diabetes. Okay, next is complications. Long-term complications of diabetes develop gradually the longer you have diabetes, and the less controlled your blood sugar, the higher risk of complications. Eventually, diabetes complications may be disabling or even life-threatening. Possible complications include cardiovascular disease, nerve damage. Left untreated, you could lose all sense of feelings in the affected limbs. Damage to the nerves related to the digestion can cause problems with nausea, vomiting, diarrhea, and constipations. And for men, it may lead to erectile dysfunction. Kidney damage also. It will also cause a kidney damage, eye damage, foot damage, skin conditions. And type 2 diabetes may increase the risk of dementia, such as Alzheimer's disease. The poorer your blood sugar controls, the greater risk appears to be, although there are theories that to how these disorders may be connected, none yet has proven. And then it may cause also depression. And treatment for this is, a moment guys, maybe I lost my for the treatment of diabetes, if the blood sugar levels are high enough at this time of diagnosis, oral medication or insulin may be started right away. Insulin is the most common kasi yun, because that is what my brother is always is using, the insulin. Okay, next is, sorry, this is all about. Okay, so how are we going to support our clients? We have to encourage the client to eat healthy, exercise daily, regular monitor blood sugar, and take the medication as prescribed by the physicians. The precautions is we have to keep track of our clients or our patient's blood sugar that must be on the normal level, or it won't go very high or very low. Avoid food ulcer or wounds, or if there is or there are wounds already, keep the wound cleaned and promote healing. Wounds need to be monitored frequently, at least every 1 to 2 or 4 weeks. When the condition result With the condition, the result is in severe loss of tissue, or when the condition is really bad, so this will result into a life-threatening infection, or amputation may be the only option of the doctors. Thank you so much.
Thank you. Thank you. Really nicely summarized, everyone. I have a few tidbits to add to this diabetes section. We're on track to have lunch at 11:45 as I hoped. Thanks for sticking with us through this meat of today's lesson. Diabetes is so common right now. Over 9 million, right, Canadians? It's tons of people. So I added diabetes.ca, our national diabetes there in the website, if you're interested in taking a peek, because that many people affected, somebody, like Belen said, her own brother, right? We know people. Ourselves might be diabetics. So just want to clarify a couple of tidbits there, that type 1, my extreme examples, the type 1, often in the childhood diagnosed because pancreas, of course, can make a little, but the pancreas isn't producing the insulin. There's that major example. There's nothing, no production. Not working. Doesn't make anything. But the type 2, we're not producing enough, or the body's not doing the right things with it. Okay? So that type 1, production doesn't exist. But type 2, we're not doing the right stuff with it. It's either not enough, there's other stuff going on. Okay? It's still being produced, just not at a rate when our bodies are not doing storage and biochemistry with what the biochemical part, the chemistry part with little things moving around, little guys with sticks on them, and they're moving, that level of what's going on in the body. Okay, it's not doing things properly with it. Okay, so that was one little piece that I wanted to add. And then also where's my note there? The gestational often does go away, but if you experienced gestational diabetes, then there might be a higher risk later in life for that type 2. Right? So there was that issue with regulation, something was going on in there, right? Not enough production, something. It's kind of like priming us. There could be something going on later on because it happened here. Right? Might not happen, but we can watch for it, right? We can be aware that we might want to watch out for it. Yeah, Nastran?
For the gestational diabetes for pregnant lady. When they are pregnant, they have diabetes 1, and after they get they
call it gestational because it's related to the baby being in there and stuff going on. The baby's in there, things are going, and then after baby's gone, usually should go back to normal. So they're not calling it type 2 and they're not calling it type 1 because it's not that. It's related to stuff that's going on because of the pregnancy. So it's gestational, related to creating the baby. That level, I think, is a little bit better. Because most doesn't pick out the biochemical processes so much. But that gestational is called gestational because they're linking it to the pregnancy piece there. Okay? So I won't call it type 1 or type 2.
I was thinking because they get pregnant and the hormones and everything change, so that pancreas doesn't maybe produce
things. Mm-hmm. But that's why also once baby goes, we're hopefully seeing it, they'll come back to normal, right? Because then the hormones start changing back and stuff like that. So it's not a type 1 where it's just, right, I'm born and pancreas does not produce anything like that. It's that different mechanism. So you've nailed it. The mechanism is different. So just watch the language piece. That's why we're not calling it a type 2. Okay. Another thing that I wanted to mention about diabetes, okay, with hyper and hypoglycemia. Yeah, Siobhan. Stop there before I.
Sorry. So gestation diabetes only occur if you are diabetic, or can that occur if you're not diabetic?
I'm no diabetes. I
Yeah.
get pregnant.
Yeah.
And my blood sugar, I'm not controlling my blood sugar. Why am I diabetic right now? Doesn't make sense. I'm not diabetic. How do I have diabetes? Because of baby growing. Then baby grows and the diabetes goes away.
Oh, so when you give birth, okay.
Really bad crayon answer, but
I get it now. I thought gestation mean you're diabetes, so you pass it to the baby.
No. The
Sorry.
pregnant lady.
Right after, it says here, sorry,
Thank you.
can I say something?
Perfect. Yeah. And not everyone who's pregnant will get diabetes, right? And Mosby, and let's also, Mosby's is two sentences, literally 2 sentences. Mosby's talks about gestational diabetes, so the focus really isn't there either for the Mosby's piece.
I got it.
Nina, you too.
Yes, the diabetes type 1, is it hereditary and it can be cured, right?
The cure question is a little bit.
It's some kind of hereditary type 1, or they're just
like, that's why they say they don't know what causes it when they say they don't know, but there might be risk factors in that sense. So they obviously, if your pancreas doesn't make insulin, like there's an error somehow, right, in your code, in your genetic code, but we don't know the cause of type 1. So that one has to be one of those, love Adriana's, we just don't know answers. I have to do that. Right? We're so inquisitive, we want to know.
So the type 2 is whatever you eat, whatever you take the food, and it become like your type 2 diabetic, right?
The type 2 is, you're either making not enough.
You're making yourself.
Your body doesn't do properly with the sugar. So it's very closely, our food intake is important because our body can't do with the sugar what a normal one would do. So you want to be careful because it can't manage the sugar properly, like a normal body. So because we can't deal with the sugar good, we want to keep the sugar down, so we need less drugs and we do less damages. That's kind of my crayon version again. Color it kind of in the lines.
Okay, thank you.
No problem. The last thing I'm gonna paint a picture here of diabetes to help, right? My extremes. This isn't Mosby's, builds extra on Mosby's, but I want to alert you to hypoglycemia, the signs and symptoms of a hypoglycemic event. Here's one of those real life stories that happened to me. I was a student nurse working in retirement home. I was very knowledgeable. I'm a smart kid. I'm an adult, but I'm a smart cookie here. I know lots of stuff. I know about heart attacks. I'm in nursing school. And there's a nurse down the hallway. That's my stuff. I'm doing my night checks. One of my clients is crying. She can't breathe. She has chest pain. She is high level panic, high level pain. Okay, so I bring her. I get her sitting forward. I think, oh my gosh, this lady's having a heart attack right now in front of me. I can't breathe, my pain, my arm hurt, and someone's sitting like everything she's on. I said, okay, lean forward, try to take your deep breaths. I open her thing, there's her nitroglycerine is there. I give her nitroglycerine, I take the time, I call the nurse, we do all the things, we call the EMS, all that kind of stuff. Do. She goes, EMS calls us back. Some of you will understand, some of you won't. It's not the end of the world. But her blood sugar was in her boots. Remember when I say in her boots, I mean it's really, really low. Depending on how you measure blood sugar, we measure it here in millimoles. So her blood sugar was like 2. Should be like a world of 7. For those of you who measure it in milligrams per deciliter, it's like her blood sugar was like 35. It's like 35. It should be like 135. It was 35. Like, that's so low. For her, she was so diaphoretic that when I was comforting her and like helping her to lean forward, I was actually soaked. My clothes were soaking wet from her sweat. Her diaphoresis. She had every single weakness, trembling, headache, all of those things, but we thought that she was having a heart attack. or I thought, I didn't know she was diabetic. She was diabetic. And her low blood sugar presented like a heart attack. So you see, there's signs and symptoms. There's just kind of like a bigger piece. There's signs and symptoms for all these like conditions that we're talking about randomly, right? Infection could look like this. Heart attack could look like this. Low blood sugar could look like this. You see the need for that evidence that we collect, right? All that data that we're collecting and we're seeing. Then I can say, okay, look, the doctor, not me. The doctor looks at it and then can put a picture together because we've collected all this evidence. Nothing is existing just
so tired.
Right? So you see, what is the dizziness? Is it because of cardiovascular? Is it because of this? Low blood sugar? Why is that happening? So the doctor going to look at the whole picture. Right? So we need to document. We need to do those kind of things. There's just as a little side thing that low blood sugar can look like other things. So observe the change in condition, document, report, right? Really, really important. My last imagery for you for diabetes, okay? When we talk about sugar, increased sugar damages the vessels. What does that even mean? What does it mean? I tell you what it means. You know me in my extreme examples. Imagine the piece of sugar is glass, is shards of broken glass. Every piece of sugar is glass, okay? So if you have lots of glass in your blood, in the fluids, and that fluids is going through the tube, through my hose pipe constantly, what is those pieces of glass doing to the side of my hose pipe? Cutting it, damage. What happens to the tube size as we get further away from the body? What do we know? The tubes get narrower, right? The tube in my pinky that brings blood here is way smaller than this tube, right? My carotid, big tube. My femoral, big tube. Remember? Core pulses are the strong ones. They're the ones that stay the longest, right? Remember our pulses when we're talking the core, the big ones? This one, smaller, the tube gets smaller, and little things. Does the sugar, do those glass particles get smaller when they go to the fingertip or to the toe? The glass stays the same size. So imagine the damage that those shards of glass, my sugar, right? They're cutting, they're damaging all of those veins and everything is getting cut, damage. So now, if I think about my feet, why do they say I have to be careful of my diabetic's feet? How big are the tubes in the feet? They're tiny tubes in the feet. If there's no blood flow going to the feet because the tubes are all busted because of glass, what about pain down there? What about infection? How is that am I going to have good nerves down there? Here's a word that you've probably heard. Diabetic neuropathy. Glass shards. Damage. The smaller your tube gets, the more damage the sugar's doing. No blood flow. Bad nerves. I can't feel my feet. If you can't feel your feet and you can't see your feet, we learned about gangrene the other day. The infection. Do you feel the infection? No. I hope my PSW sees it when she watches my feet. You see a cut on your right. You see, oh my gosh! You realize now. Holy shoot! Allison was really serious when she was talking about diabetics and feet. I file nails. I am not certified in diabetic nail care. I file so I don't risk getting a cut when I do their toenails. See that circle? Are you guys able to connect that circular thinking there? So again, when I think of what's my role as the PSW, skin assessment on my diabetic clients is a huge role. Observing for that breakdown, for the infection, for the changes, for the smell, for the purulent discharge. No kitty cat discharge, purulent discharge. I'll write it again. No kitty cat. I have to write it because I've seen students write it in the chart the wrong way. It's so not okay. You can't use that word. What? That's it. That was my line in the sand. It's purulent. Pus becomes purulent. That's it. Learn it. That's how it gets started. There's no mistaking any language there. So you're reporting those changes, that skin integrity, all that stuff, that's important for us, right? The nutritional intake. So you going to help, you go to clean your client's room, you go to help them in the shower, you go to make their bed, and you notice your diabetic client has a candy bar stash underneath their bed. Should we be reporting and documenting? Yes, right. What am I thinking about? What am I thinking about as PSW? That holistic care of my client. Okay, hopefully that glass, that sugar is glass. If you think of it as broken glass in the blood, that hopefully helps to create that image of how does the blood vessel get damaged in diabetes? What are you talking about? How do we get this neuropathy? How come? This damage, and that flow. Okay. I never know if it's going to work. And you guys see that. Sometimes I get partway through and then I realize it's not working. That's not always effective, but I try. It isn't glass, of course, but that visual, I hope, helps to connect the damage that can be done at that microscopic level. You don't see the sugar in the blood. I pick my finger. Oh, last thing. There's my ADHD brain. The last piece. That's why we take people's blood sugars. When I say, oh, you're acting funny, I might just take a blood sugar. I'm gonna take your vital signs. You're gonna go into practice, you're gonna go into clinical, and you're gonna think like, why did the nurse take a blood sugar with vital signs? That person's not diabetic. Literally, we just want to check. We want to make sure you're not hyper or hypoglycemic, right? That's something I can fix with sugar. A drink of orange juice. You know what I mean? Like, it adds to the story. So it's an easy sign, it's an easy check, right, that we can do as well. Pop a blood sugar. I wish I had done that to my poor lady, and I wish I had known, you know what I mean, check the blood sugar when I thought she was having a heart attack, because we might have been able to save her some pain and anxiety by giving her some of the sugars. She still probably had to go to the hospital because it was so low, but maybe we could have helped her feel a little bit better in the interim, right? That moment, that was my learning moment, where I always check, what was the blood sugar? Just want to know what's going on, as someone who doesn't eat a lot during the day. Why might I be a bit dizzy? It's coming dinner time. And I say to my husband, I say, oh, I'm really just I feel really tired. I've got a headache. I feel kind of dizzy. I can't make dinner yet. He later turns to me, he's like, you feel dizzy because you have no blood sugar. You need to eat dinner. We need to eat dinner so you don't feel this way. But then I'm procrastinating dinner because I feel bad, but it's because I didn't eat. Right? So it's like, right, I always just think, what's the blood sugar story alongside the vital signs? Because I promise that doctor, when the nurse or whoever has to call a doctor later, or the doctor's reading the notes, the doctor's looking at the documentation, they're going to love to see that story alongside the vital signs. Okay? Awesome. Let's have a wonderful lunch. Any extra time, obviously, read ahead. I am done my endocrine, so I want to lecture for 45 minutes or so after lunch to finish urinary. If I can start and finish urinary, that will be my goal. I would love to get that done in that hour, and then we'll go into independent study time at the end as well. So let's return from lunch because I got a big meeting and I'm not going to be able to leave my chair. 13:15, resume my paper attendance today. All right. Thanks, everybody. See you after lunch.
See you after lunch. Bye, everyone. See you after lunch. Okay, tapos na po sa diabetes. Diabetes mellitus. Save. Wa pa sila human sa ilang discussion. Oh my God. Oh my God, Cassie. Pakita ko lang bike ko. Nasa gilid. Ay, naku po, Belen. Kailangan ko mag-study para sa aking... Sige, mamaya ka na ha. Dito muna ako sa aking...
You've got a lesson you're absolutely going to love.
Oh boy!
About what it means to obey.
Obey?
Obey.
Oh, great.
Oh, yeah.
Oh, no.
I-off lang natin baka